If you run or play sports and you're suffering with knee pain without there being any sort of trauma or incident or injury, then this video is perfect for you. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin. So you can get pain in your knee. It's nothing necessarily to do with damage in your knee. A lot of the time, if that happens without there being any sort of incident or trauma or injury, it's an issue in your hip. There are lots of muscles here: groin, hip flexor, quad, hamstring. They all come down and attach in and around or below your knee, and it absolutely has an impact on your knee joint. Say if there's an issue around your hip, that can lead to excess stress and forces going through your knee joint. So you can develop knee pain, but if you just focus on the knee trying to get that better, it's not really going to work for you. You have to come back up towards the hip. That's what we're going to cover in today's video. So this video is going to be absolutely perfect for people who are under a little bit of pressure to stay playing or training. If you were to do these exercises and actually take 7 to 10 days off, that would probably be enough to let this issue settle down. Certainly if you add in deadlifts or another strength training exercise. But say for people who are under pressure to make training and play a game and you have this knee pain and you can't really afford to stop, well then doing this before you exercise and also doing it maybe the next day if your knee is sore as a pain relief session is really, really effective. If you have any questions or comments on any of this stuff, please comment below and I'd be happy to help. And if you like this evidence-based content to keep you pain-free and recover from injury, just like and subscribe. Let's get started into the exercises. There's 6 in total. The first is a glute band and a glute stretch exercise. Then we're going to use the red band here to work the groin, hip flexor and hip. And we're going to finish with 2 landmine exercises. So let's get going. Your knee might be a little bit sore to do some of the other stuff first. So just lying on your back. The purpose of this exercise is just to increase awareness in around this area here. So a strong band, try to burst the band with your knees and then lifting your hips up and down. So you know you're doing it right if you feel it here. If you have a strong band, do 10 or 12, take a little break, go again. Just get a lot of activity there and then follow that up by getting a good stretch through here. So in this, put your hand on the outside of your knee and above your ankle and bring it across, bring your shin across towards your opposite shoulder. You should feel a stretch out in this area here. Just relax. Stretch for 8 or 10 slow breaths. You can do that on both sides. And you could repeat that again. So go back into your banded bridges and your stretch. They'd be the first 2 exercises that I would start with. The next 2 exercises involve working the groin, hip flexor and the glute muscles. You're going to do these exercises on both sides. I'll demonstrate it on one, but you would follow up doing the right leg by then doing it on the left leg. What I want you to do is come across into this side. So hip, knee, shoulder are all in one line. And you sit down into it, so you get a little bit of a stretch here. Now what you're doing is bringing this foot, lift it up an inch and bring it across in front of your other foot. So over like that and back down. So you sit down into it. So I'm getting a little bit of a single leg squat on my left leg. And on this leg here, bring it all the way across in front of your other foot. The purpose of this is you should feel here working and you should feel your adductor or groin muscle working here. Now, it's not going to work well if you half-ass it a little bit like this and you're coming over here and just the band resistance isn't strong enough. That's not going to work. It needs to be a tough enough exercise, and you can make it tough by how you actually apply yourself in the exercise. So when I pull it across here, sit down into it. If balance is a limiting factor, hold on to something. So I can feel this leg working, this groin, go to where it's a 7 or 8 out of 10 effort. It might be 20 reps, 25 reps, and then do the same on the other side. The next exercise from that, and this is a pretty tough group of exercise, but very beneficial. So here, in this position, go to the point where you can feel a little bit of a stretch on the hip flexor here, but you're really working this side. So if you look at the left side here, I'm pushing down through my left foot. I'm driving this foot up, sit back down. So here as I'm doing this, let this leg back as far as you can, pushing down through your left foot. So this leg and this hip gets a little bit of muscle activity here. You're working the hip flexor on this side. Again, that should be pretty difficult. Go to where you can only do, a few more repetitions. The exact number depends on the strength of the band, but let's say in around 20. And again, then you would go straight from that to doing it on the other leg and straight into it there again. So then I would go back to the first exercise, and so you do 2 sets. So after you've that done, you've had a little mini workout to this area here. If you've done that correctly, and if this is going to help you, just doing that should make your knee feel a little bit better. You've worked hip and glute, hip flexor, groin, and say this is the sore leg. It automatically should feel a little bit better. There are 2 more exercises that you can do if you have access to it. If you don't have access to a bar, just do these. But if you have and you can cope with it, let's add in 2 more exercises. We're going to go with the landmine exercise. Feet nice and wide, sit down into it. And what you're doing is chest up, arms are locked out. Keep your little toe on the ground here, and you're just sitting over and back. So as I come over here, keep your little toe on the ground, sit back into it. You're just opening up your hips. Over and back is 1. Let's say you do anything between 8 and 12 repetitions. Try not to be coming up and down, stays at the same level. Rock over and back. And you should really feel that just opening up the hip and groin area. Doesn't need to be heavy, that's 10 kg on it. The final exercise is a landmine reverse lunge here. In this position, trap it here with your elbow. Hold it like this. You can lean into it a little bit if you want. We're working the outside hip here. So what I'm going to do is I'm going to step back with the other leg and come across a little bit here. So my foot is out slightly past this foot. And from this position, pushing down through this foot, down to the laces with real intent, and drive your hip up. Step back and across, and have all your intent going down through this left foot. So again, 8 to 12 reps, doesn't need to be, that's 10 kg, doesn't need to be much heavier than that. And that should mean that you feel muscle activity on the outside of your hip. Then again, you would swap over and do it on the other side. So there's your 6 exercises. After doing that, you should feel a lot better in around your knee. And if you do feel a little bit better, that's an absolute sign that doing more of this more frequently is what you actually need. If you had a chance to step back from playing and do this for 7 to 10 days, it would probably do a lot to really help it. But if you want to keep playing, like I said at the start, there's an onus on you to do more before you start playing and recover afterwards with these active sessions. I hope that helps. If you have any questions, please feel free to comment and we'll get back to you.